Welcome to the All In Podcast. I'm your host, Pat Washington. Thank you for joining us today. The All In Podcast is brought to you by the National Urban League, the Urban League of Metropolitan St. Louis, the Centers for Disease Control and Prevention, and the National Action Network. We're all in against COVID, and we want you to be too. This is where you can find information and education and stay up to date about the latest news in the fight against COVID-19 so that you can protect your family, protect yourself, and protect your community. We're all in against COVID in St. Louis. We're all in against COVID at the Urban League. Go to ulscl.com and you can get more tips and more information. And you can take the All In Pledge and learn how you can take part in the fight against COVID-19 and keep your community safe. We have a great show lined up for you today. We're going to talk with Mr. James Clark. He is the Vice President of Public Safety and Community Response for the Urban League of Metropolitan St. Louis. He's been doing a phenomenal job with his team with vaccines, testing, vaccine education, community outreach, and they have rolled out a new initiative with the Community Health Navigators, so we'll learn all about that. We'll also talk to comedian DL Hughley, and he'll talk to you about his experience with COVID-19, and he's got some advice for you for how to keep your family safe. So don't go anywhere. You're listening to the All In Podcast. We'll be right back. And welcome back to the All In Podcast. I'm your host, Pat Washington. We are talking today with James Clark. He is the Vice President of Public Safety and Community Response for the Urban League of Metropolitan St. Louis. And James and his team have done nothing short of just amazing work throughout the pandemic. And now, it seems like some of the greatest pressure is off in terms of keeping our community safe. We want to try to be a little less reactive and a little bit more proactive. So James is going to talk to us about what the Urban League is doing and what the Division of Public Safety and Community Response specifically doing around COVID-19. So James, thank you for joining us. Thank you.
Oh, Pat, it is great to be here. Happy to be here with you.
So we're going to have a little fun today, and we're just going to talk about all of your programs. I know there's just some amazing things that you have going on. And what I want people to understand is that your division is a new division for the Urban League. This is something that was not historically part of the programming, and Urban League President and CEO Michael Patrick McMillan saw a need and knew that it was important to have a grassroots community-based effort to address some of the need in our community, and created the Division of Public Safety and Community Response. So before we talk about your work around vaccines and the public health, tell us a little bit more about the division. What are the programs that you have going on right now? And what are some of your successes and challenges?
Well, Pat, once again, thank you. And 2 years ago, the Urban League, under the leadership of Mike McMillan, saw that there was a need for the Urban League to have a infrastructure that can go straight into the neighborhoods and begin to resource neighborhoods. So the Federation of Block Units was in place and doing an outstanding job what we were able to do is to align with the Federation of Block Units, but then look at how we could begin to address some of the most pressing needs in our more challenged neighborhoods. So we took a very hands-on approach. We believe that social service for too long has kind of been hydroplaning over neighborhoods, studying and analyzing neighborhoods, and knew that we had to take a deep dive. So, in the Division of Public Safety, we focus on a lens that we call the NPL, the neighborhood, the front porch, and the living room. And we have strong programs that really address the most pressing needs, one of which is resourcing families. President Obama stressed that there were food deserts, meaning that there were places in neighborhoods, that there were places in the urban core where there was no healthy fruits and vegetables. You can use that same lens and acknowledge that there are resource deserts. There are neighborhoods where there's a large resource void, and when you look at it, those are the neighborhoods that lead in crime and violence. So through the new Serving Our Streets program, we deploy urban engagement specialists into the neighborhoods. Those are men and women who come from the neighborhood, who understand the group dynamics, understand the neighborhood dynamics, the motivation, how to inspire people in the neighborhood. So we deploy urban engagement specialists, and we focus on very specific areas, about a 4 to 8 block area where they go door to door and they work to get an assessment of each family living within that target handprint. We don't call it a footprint because that means you're stepping on something. So as we accomplish the assessment, we then give that information to case managers, and we case manage the neighborhood, making sure that the families get the resources and get the services that they need, be it an Urban League resource or a resource that the Urban League does not provide.
So when you say
So
resource, let's be very specific because we want this is a very neighborhood based, it's very individualized. So when you say
yes.
resourced, what do you mean when you say resources?
Well, Pat, we do an assessment on the entire household, everything from the mother to the father to the uncle to the grandmother. They have
Because
individual
we live
needs.
like that, right? Because we have
Yes,
intergenerational. We have them all in the same house. Yeah, that's
yes, yes. So we want to know what are the needs for every member in the household. If it's a family member has an outstanding warrant, traffic warrant, if it's the nephew needs a job, if it's the grandmother needs to be enrolled in senior citizen services, if they need utility assistance, if they need mortgage assistance, and our case managers contact the families twice a week to see if some of those needs change. So we have very deep nurturing relationships with families in our more challenged neighborhoods. And as the families' needs change, then our urban engagement specialists and our case managers are there to help meet those emerging needs. Um, and it's been a model that has proven itself where in our target neighborhoods, in our target areas, crime is trending down. We also look at how we identify the high risk people that live in those neighborhoods. Who do we need to give some special attention to that may be prone to illegal behavior? And we really work with them hands on a more frequent basis.
well. We're going to talk in a few minutes about your work with COVID-19 and with vaccination and testing and some of the emergency relief efforts. But there's one particular program that I want to point out because I truly believe that it is a public health issue, and that is crime and violence, particularly as it relates to gun violence. One of the programs that you have is the gun violence de-escalation program. Can you talk about that?
Well, Pat, it's an issue in every major city, where individuals seek revenge. Individuals take small situations and they turn into gun violence. We have been working in this space since 2015, where we have a team of individuals that are out in the neighborhood, looking for conflicts that have a trajectory towards gun violence. We work with the circle of care, meaning the family members of the adversaries. We never go straight to the adversary, because if we don't get it right, they will then put up a wall. So we work with the grandmother, we work with the aunt, we work with the former football coach to see what's the best way to approach this individual. And we work literally around the clock to de-escalate the conflict. So far this year, we have successfully de-escalated 53 conflicts that have had a trajectory towards gun violence. And then, Pat, if we cannot de-escalate the conflict, then we relocate one of the adversaries. This year, we've had to relocate an entire family. So we have taken a deep dive into this gun violence reality. We do not work with law enforcement. We have an extreme amount of credibility in the neighborhood. We work with mothers who overhear their son or now even their daughter on social media, and so it's a much needed service in our neighborhoods. So our gun violence de-escalation model is now looked to be replicated in other major cities.
Well, I like what you said about replication, because it has to be, any solution is going to have to be scalable. It's going to have to be something that you know that can be utilized in other communities or in other ways. So that's an important factor. I appreciate that. We're going to take a break. Thank you for sharing about, just to giving us a general overview about your division. That's just a small overview, because we know that you have opioid triage programs. We know that you
Yeah.
have mental health and wellness programs. We know that you have a whole tactical team that really responds in the community, whether it's flood relief, you've been helping with that, whether it is COVID-19 emergency disaster relief, whether you are cleaning up neighborhoods and helping them be prepared for development through your Clean Sweep program. So you really do have a comprehensive division in terms of community response. So thank you for all that you do. And when we come back from this break, we're going to talk to you very specifically about your work with COVID 19. We'll be right back. Welcome back to the All In podcast. We're here. We're talking with Mr. James Clark. He is the Vice President for Public Safety and Community Response at the Urban League of Metropolitan St. Louis. And we earlier had an overview, of all of the programs within the Division of Public Safety. And I can tell you that that is one of the busiest and most impactful components of the Urban League program right now. The Urban League offers over 55 programs and services, and I can tell you that the Division of Public Safety and Community Response is one of the busiest divisions at the Urban League. So again, we do appreciate the work that you and your team do, Mr. Clark. You have a magnificent team, you have a great strategy, and the impact is felt throughout our community and across the state. So much so that as it relates to the COVID work that you're doing and some of the other work that you're doing in the community. Governor Parson just came out and said it that you and your team, working with the Missouri National Guard, operated the most effective and most efficient COVID-19 vaccination and testing operation across the entire state. So kudos to you for that. So we're going to talk about that effort. Tell us, you've been able to vaccinate thousands of people throughout the St. Louis metropolitan area, whether they were teachers or bus drivers or students. Talk to us about that effort.
Well, Pat, it started when I was bed stricken with COVID myself, and just as I was coherent, we got a phone call from the governor's office asking if we could assist the National Guard in getting into 5 senior facilities. And I said yes, we would. I text our CEO, Mr. McMillan, who has had a who has long standing relationships with senior facilities, and Mr. McMillan said yes. But I told the governor's office that we would need about 15 days so that I can recover fully. And Pat, what started off as 5 senior facilities grew to 75 senior facilities. And when the tiers changed to school teachers, with our relationships with the St. Louis Public Schools, Dr. Adams welcomed us in, and we provided vaccines for all St. Louis Public School teachers. Then we pivoted to county school districts, where we did 12 county districts. Then we were able to provide vaccines for bus drivers. We then pivoted to the restaurant workers, grocery store employees, postal workers that work inside, and then also the mail carriers. So it really just continued to grow. And as you mentioned earlier, we were very fortunate to have a very dedicated team. We then opened up 2 full-time vaccine clinics at St. Louis Community College and at the Delwood Recreation Center. Then, when the National Guard's orders were rescinded, we had a strong partner step in, Visionary Vaccines, and we continued to do vaccinations at senior citizen facilities and at neighborhood churches. And most recently, we were able to hire due to a HRSA grant through the National Urban League. We were able to hire 20 vaccine navigators. These individuals go into the neighborhood 5 days a week, sometimes 6 days a week, working to identify individuals and families who may need the first shot. Some need a booster. And they are also now going back into the senior citizen facilities to give senior citizens boosters. Most recently, we received a grant from the state of Missouri, and the Monday after Labor Day, we'll be opening up 2 full-time vaccine sites at neighborhood churches.
And see
So,
that
Pat,
that's critical. That is critical. You hear that word repeated over and over, in the neighborhood.
yes.
Access is key. So tell us about these 2 new sites.
Well, Pat, we have a strong relationship with neighborhood churches. We think that the church is central when you're talking about stabilizing neighborhoods, when you're talking about creating a partner that can deliver resources to hundreds of thousands of families. So, with that lens and out of that vision, we looked at the data, working with St. Louis City Health Department, working with the St. Louis County Health Department, and we looked at which churches strategically were located in neighborhoods where vaccine rates were low. St. Louis County data pointed us to Greater St. Mark's Church that's in North County. Working with the St. Louis City Health Department, they thought that Pleasant Green Missionary Baptist Church was in a key location. So we are very excited. We will focus on the residents that live within the initial first blocks. So we'll do a strong campaign door to door. Then we will work out. So just very excited about being able to consider, and then Pat, just to have this infrastructure in place so that if monkeypox continues to spread, we will be able to just look at where we need to be and mobilize in a very short period of time.
Well, we are entering, that season. It's cold and flu season. We've had
Yeah.
this out of nowhere surge in monkeypox, which is actually a virus that is akin to smallpox, and there are 50 cases, 50 known
Mm.
cases across Missouri right now. And this is just as our children are heading back to school. So you and your team were very instrumental, as you said earlier, in getting teachers vaccinated and working with the pediatric vaccines once they became available.
Yes.
Are you still working with schools to get children vaccinated,
Yes.
and do they get boosters as well?
Yeah, Pat, we are working with the St. Louis City school district as well as several county districts doing vaccines as children return to school. We are also talking with several healthcare providers in the St. Louis metropolitan area that are going to start doing flu shots pretty soon. So, with this infrastructure that we have here at the Urban League, that includes St. Louis City recreation centers,
Yes.
that include the neighborhood church, we want to have the ability to uh, provide the vaccines, provide the boosters, provide flu shots. And so that's what it's about right now, building an infrastructure where we can respond rapidly.
Well, the Community Health Navigators is a new component, and that is, as
Yeah.
you said, through a grant that was awarded to the Urban League to actually hire these people and put them out into the community to go door to door. And their number one job, as I understand it, is to make sure that we are actually getting shots in arms. Is that correct?
Yes, Pat. They have a goal of getting 4 people vaccinated a week. And then I can't thank the National Urban League enough with the All In campaign. They really received the necessary training where they know the neighborhoods, being able to be trained regularly on what do you say when you run into certain questions. How do you overcome the high level of vaccine hesitancy? So we thank the All In campaign. We thank the National Urban League, um, Ali and her staff, Jody and his team have really done a good job equipping the navigators with the information and really with the technical support.
Mm-hmm.
Because you know you are dealing with people who are not used to loading in data. So it's been a very rewarding experience for the navigators. It's a well organized team, but with the information and with the training, it was very valuable. And really, that's been the key to the overall success.
Well, we had an opportunity to talk to Jody Easley in one of the earlier All In podcast sessions, and he had nothing but great things to say about the work that
Yeah.
you're doing in St. Louis. He spoke very highly of the navigators that you've selected to be part of that team, and felt very strongly that you'd be able to accomplish those goals. So I'm glad to hear that it is going well and the training is critical.
Yeah, Pat, it's very exciting. When you look at the healthcare disparities, Jody and I see it the same way. We know that you and Mr. McMillan see it the same way. The National Urban League. How do we put an infrastructure in place so that whatever the healthcare needs are, we're able to address them rapidly? And it's about building an infrastructure. Our neighborhoods need an infrastructure where we can get things into the neighborhood, onto the front porch, and into the living room in a very quick turnaround. So very excited about this, and the partnerships are very strong.
Well, thank you for taking time out of your schedule today to come and tell us a little bit about your work. And I do mean a little bit, because there's just a tremendous amount of work that you're doing. And we want to have you back to the All In podcast so you can tell us more about how the newest health clinics are going. We do also want to talk to you about your opioid triage work and the things that you're doing with that, because that's so important. And so we want to take a deep dive into that and learn what you're doing in the community. So thank you. We've been talking to James Clark. He is the Vice President of Public Safety and Community Response for the Urban League of Metropolitan St. Louis. And if people want to reach you and learn more about the work for serving our streets or our Community Health Navigators, how can they reach you?
They can reach me at jclark, JCLARK, at urbanleague-stl.org, or you can reach me directly at 314-615-3637.
Well, we want to remind people as we go to the break and get ready for the second half of the podcast, DL Hughley is coming up. He's going to talk to us about his experience with COVID-19. But our role with the All In podcast is to help you get information and education to keep your family safe. It seems like the pandemic is winding down, but it's important that you understand that we are still in a pandemic. And we had Dr. Maddie Davis. She is the director of the St. Louis City Health Department, and she just was very clear. It ain't over. So it may be lulled. It may be, we may be not seeing as many cases or new cases, but people are still getting sick. People are still dying, and disproportionately so, African Americans are being impacted greater than anyone else because of this pandemic, through major impacts to health, job loss. Families are being impacted in a greater capacity. And now we have a flood on top of COVID-19 and monkeypox and everything else. So it's going to keep the All In podcast busy, but we want you to realize it's not over. So go to ulstl.com. You can get latest information about COVID-19, about the vaccines, about efforts going on in your community, like Mr. Clark, what they're doing with the 2 new health clinics and 2 new vaccination clinics. We want you to be informed. We want you to be able to take care of yourself. We want you to be able to protect your community. So we're going to take a break, and when we come back, we're going to talk with comedian DL Hughley. Stay tight. We'll be right back. Not already.
Oh, I'm sorry. We ain't drinking.
It's bad.
Hey.
It's bad. What?
How are you?
You want Mike over there?
All right, let's get in. Let's make it happen.
Good to see you, sir. Thanks for being here. Oh, yeah, I got it.
What to do?
What up, Q? What up, Q?
Anybody else?
Whole attitude change just that
Everybody back for me?
I grew up in LA. There ain't nothing but Spanish people up there. The difference between black and brown people is the color they be.
Okay.
White,
Right.
black,
Right.
pinto, northern.
Right. And what you put in? See,
Yep.
I'm chopping mine up, and I'm gonna put maybe some neck bones.
Yeah.
And I'm gonna slice some tomatoes and a little okra.
Yeah.
Some other people, they're gonna put avocado and salsa, and I'm not
Now
doing
you
that.
talking that? That's what we do.
See,
That's what we do.
no, I'm gonna need me some skillet bread. I'm right. Every Saturday, there would be between 5,000 and 10,000 people just lined up, waiting, pop their trunk, drive through.
I saw that on the news.
Just like you all did out there just a minute ago. 36 consecutive weeks.
So this sometimes it's the only thing we have to eat.
Mm-hmm. Yeah. When you think our average client makes $14,000 a year. $14,000 a year. 80% female head household. Right? And if it weren't for this and our pantries and the vouchers, they wouldn't make it. You know? They just wouldn't make it. And you're talking about
Where does the food come from?
Operation Food Search, donors. Mr. McMillan is a prolific fundraiser. You don't mind asking nobody for a nickel. And so he raised over $5 million to buy food, right? And we have to do that on a regular basis because the pop-ups that you see outside, those were not part of our plan. But because people were hungry.
And y'all have good stuff out there too. I started
You
thinking
hear
about it.
me? I'm like, I'll put one of them boxes in the trunk, right? But that's the whole idea. It's something that quality food that people would be able to feed their family of 4 for 2 weeks. And so that's what we do. And it's
like
hard.
grocery shopping.
It's like grocery shopping
Yeah.
with dignity. You know, I know it's a line out there, but we try to
It's a
treat
line at
everybody
the grocery
with.
store too.
Hear me?
It's a line at Six Flags too. So.
Right, it's a line at your show tonight. You know that,
Yeah,
right?
yeah, of course.
All right, I'm so glad you're here
I'm
today.
glad to be here.
You know, it's raining, but you brought so much heat. Everybody's sweating.
Everybody say that. Yeah,
You brought all the heat. You brought all the heat. We are right here. We are live in Jennings, Missouri. Like they need any more heat.
Yeah,
Not
yeah. You know, but it's been hot everywhere. So
Yeah.
this is a break.
Yeah,
It's a break.
it is. It's like, it's humid, but we'll take it,
Yeah,
right?
yeah.
Okay, so we are in Jennings, Missouri. This is the Urban League's Jennings Empowerment Center. We have our mayor of Ferguson, our mayor over there of Northwoods, and several other guests here with us today at our pop-up food distribution. We've done this for several months now. Nearly 5,000 people have come out and taken advantage of the opportunity to feed a family of 4
Right.
with what we distribute for about 4 weeks. So thank you for coming out
It
here
was
today
my
and
pleasure.
hanging
My
out with the
pleasure.
people.
It makes your heart glad when you see. We were just in Buffalo. We did a thing for the people that had you know, as far as what happened in Buffalo.
Yeah.
And that store is closed.
Yeah.
So those people have nowhere to eat.
And that was the only store.
That was the only store, and it's like, it really is sobering, the plight of our people. We really have the brink of starvation.
Absolutely.
It's efforts like this that stand in the gap. So it's just, it's very horrible.
So we started out with the food distributions as part of our COVID-19 emergency
Right.
relief. And so we are continuing with that because food deserts, you know, prices are going high, gas is high. You
Right.
choose between, do I put gas in the car
Right.
or do I put food
It
on the
is,
table?
yeah, right.
And that's really where we are.
Right.
So the other thing we want to talk about with you today is COVID-19.
Uh-huh.
Because Black and brown communities were hit disproportionately, you know, in relation to other communities.
Sure.
And I know you had your own struggles. with
Sure.
COVID.
Well, yeah, and it's funny because it's very interesting because we're in a position where our needs and our fears are colliding. The things that we need are at odds with the thing we've always had to come to grips with. So it devastated our communities more because we live closer to each other in close proximity. We have less access to proper medical attention, but and it's also a lot of mistrust.
Right.
Like you want to start an argument, it ain't over football games or politics or God. It's vaccine or no vaccine.
That's
And
it.
I think it's a shame because you have arguments with people that have keloids on their arm for vaccines telling you how to get them. So I just
Right, it's like, which vaccine do you want, right?
right. But I think that you have to be as patient and as informative and clear as you can be. And there's some people you're not going to convince. And I think the saddest thing is I don't know how many people that I talked to right before they went out and said I should have listened. So, and no, this is not even a fear-based thing. It's just things I've actually seen. I remember when I was in the hospital, when I passed out on stage, it was a kid that was 28 years old. He didn't make it. Now, you can't say what'll happen. I was blessed, you know, and I had a long haul COVID for a very long time. And I think within the last year, I've kind of turned that corner. But it's just sad and devastating to see.
And I think we have, back to the trust issue, not only do we not trust the science, we don't trust our eyes.
Of course.
Just like you said,
Well, sometimes I don't want people to trust their eyes. No, but it
Trust
is.
me or your eyes.
It is. But it is. No one can pretend like our interaction with science and medicine has been a fruitful, honest one.
Right.
But the way vaccines work is that enough of the population has to be immunized, so that the rest of the population. So there's only one virus has been removed. That's what is it? Smallpox.
Mm-hmm.
And it took hundreds of years to do it. It killed 300 million people. The polio is on the verge of getting eradicated, and it's only two places that exist. One is Afghanistan and Pakistan. So when people don't understand that you had to take that shot or you couldn't go to school.
Right.
Like the very polio vaccine that they in 1955, my granddaughter took a version of that.
Mm-hmm.
So they've always been in our lives, but I think it's the speed of it, how it came together so fast. There's so much misinformation.
Right.
Clarence Thomas, who's a Supreme Court judge, said he thought it came from embryos. I'm like, how the hell you in a robe and think that?
And
It's just that, but you can click on something, say this art, but it doesn't have to be connected to anything. So I think you can only trust your healthcare professional, like the doctor who you've seen, and the people around you to the extent that you can. But I really just think that we have to dispel a lot of the untruths.
Right.
And understand that 1 million people died in this country. And the disproportionate number of them were black and white.
Exactly. And I'm gonna look at this camera and I'm gonna say this, and I'm gonna say this as directly as I can. You cannot get on TV and declare a pandemic over.
No.
People are dying every single day.
Yeah.
It ain't over.
Right.
So we still have to do what we need to do.
Right.
You get vaxxed, get boosted, mask up, social distance, take, get the sanitizer, stay
Right.
away from people.
Right.
If you're all up under,
It's hard
because we do that. It's about
Yeah.
14 of us, in here right now standing next to
The thing about us is that, and this is, the pandemic hit us harder because we need to be connected.
Right.
We need,
That
people don't
communal
understand.
village.
We, if you take a baby that's born and it has no significant interaction with human, no touch, the chances of it growing up and having, mental problems or being a sociopath are exacerbated. We need to touch, we need to be, and the only way that gets to happen is if we are safe as a community. You can do that, see, I turn the camera off now.
No, you said we need to touch, so I'm serious.
People don't understand, and I go all over the country and I see situations like this, and it's very hardening, but it's very sad because everything hits us. If it's good, it hits us worse. If it's great, we get a little. So it's very, as happy as I am to see stuff like this, it's as sad as I am that it's necessary.
Well, we're all in against COVID here at the Urban League. We want people to get vaxxed and not fears. So thank you for joining us. Thank you for doing everything you're doing. Thank you for speaking out, and we just love you.
I love you back. Thank you.